All right. 3, 2, 1. Needle pod.
Needle pod.
Always off. But welcome back, everyone, to our Needle podcast with Paul Cloran and Ellison Melrose. I am taking the lead today to chat with Paul a little bit and get to know him a little bit more. If you guys are on this podcast, you might know a little bit about Paul, but let's kind of dive a little bit deeper into who Paul is as a person and a clinician and all the things.
I am so curious to know what you're curious about.
Yeah. So first of all, tell us a little bit about who you are, where you live, what you do. Let's start there.
Sure. Yeah. Paul Cloran. Most of you know I'm a physical therapist, Regis DPT grad, proud Tim Flynn, Julie Whitman, that era of Regis University in Colorado, originally from Wisconsin. And I mean, if you are with me for an hour, I'll find a way to let you know I'm from Wisconsin, whether it's a PBR or a cheese reference or a Packer discussion. So born and raised in Wisconsin, currently living in Washington. So when I graduated from DPT, didn't feel a strong urge to go back to Wisconsin. Colorado, although I loved my time there, was kind of a tough PT market for a new grad. So I applied for jobs everywhere, like Washington, Alaska, California, and I wound up at a PT mill out here in Washington. Hated it, questioned leaving the profession pretty quickly. So did some contracts, one of which brought me to Minnesota for a few months, but then right back to Washington, working on campus at Microsoft. And I mean, it's around that time that I had taken some dry needling courses right out of school, but it's around that time at Microsoft I actually started using it a little bit. And I mean, from there is the story that most people know, my current hats. I'm founder of iDryNeedle, and for a while was the full-time president. No longer full-time president, but still actively involved. So I just say I'm a member of iDryNeedle, founder of iDryNeedle. Have been teaching dry needling Con Ed, wearing different jerseys for a while, since 2014. We launched the ICE dry needling division in 2022. And I mean, I think that's where we're at. I mean, I had once upon a time a similar clinic to what you have. Yours looks way cooler than ours, but it was a purely cash pay, 2 treatment rooms, a big gym, out of network. People were coming to us for needling. So I had the, full-time clinic ownership, 40 plus hour a week patient care grind. Now I'm nowhere near that. Concierge clients. There's some weeks where I have 1 client. There's some weeks where I'm really busy and I see like 6. But that's my life right now. And man, thinking back to like when I was so burnt out as a new grad, I love that I treat now because I want to. And it's people that are invested in getting better. They see the value in the services, and it's just none of what made me question getting out. In fact, it's all of the things that made me want to get in the profession. Valued care, as much time as I need with my clients. I know that puts me in kind of a fairy tale land on courses. So that's why we need folks like you and I guess my previous experience as an owner to know what the real professional life feels like, but also the clinic side, and especially when all of the dry needling questions pop up.
Definitely. You are also a father of 2.
Oh, yeah.
A husband.
I was just going through my CV.
I know. An avid CrossFitter, recreational CrossFitter is, I think, what you like to say. What is so let's kind of dive in. I was going to say, who's your favorite kid? Just kidding. Let's not go there.
The first.
What is your favorite CrossFit workout? I think we talked a little bit about your origin with CrossFit last podcast with Mitch, and he kind of kicked your ass a little bit on your first CrossFit workout. But things have kind of evolved from there. You went through an Achilles injury. Wow.
For my Achilles, yep.
Yeah. Was that during CrossFit or was that outside of CrossFit?
I mean, I was early in CrossFit when it happened, but it did not happen. Like, it didn't happen while I was CrossFitting. I was playing co-ed soccer, non-contact. I mean, if you have seen patients who are 35 plus years old, non-contact Achilles ruptures, it's the same story that you've heard. Was just running, change of direction, loud pop. I mean, I thought someone had come up and kicked me from behind, but it was a very loud snap, and that was my Achilles, but non-CrossFit related. I think my favorite CrossFit workout.
I do. It's DT. Yeah.
If I had any strength, I played Division III college football. I could hold a barbell just from my previous training, but I mean, no gymnastics, no skill. I do okay with like just dark, pain caved
Grunt
engine type
work.
workouts at this point, but
Yeah.
the
No.
gaps are many. Low performing, but avid. I mean, my goal, which I achieved in 2025, was 5 workouts a week, 5 CrossFit style workouts a week. So I
Mhm.
got better with lots of stuff, but man, the gaps are still many.
Yeah. How do you juggle that with being a parent, being a,
Yeah.
business owner with, or like course content developer and all that stuff and the
Yeah.
travel?
I mean, what makes it easy on the home front is Jen, my wife. We joined CrossFit together. And I
Mhm.
mean, to talk about seeing an inspirational role model for no excuses, I watched her CrossFit through 2 pregnancies and very quickly postpartum. So, I mean, we just did it as a family always. And what that meant was, I mean, 6 weeks old, Aiden and Wesley are in the corner of the gym with their headphones on and just they get used to the loud music and the barbells banging. So, what's made it easy on the home front is just we've always done it as a family, which is a blessing. I mean, it's not like I need to find time to get away from the family and get back really quickly. It's just we love our current gym. It's got, I call it a cage, but it's a kiddo area where they're contained, but you can see them. They're very happy with their other kid friends and their toys. So,
Nice.
and then on courses, just I'm not just there for just to like pretend like we're going to go through a workout on the weekend. Like we're going to dial up some shit because this is also my time for fitness. So, I
Yeah.
mean, if we have access on a course to dumbbells, barbells, a rig, we're sending a fairly, I mean, infinitely scalable, but I'm trying to send a fairly intense workout even on the weekend courses.
Yeah. So I think that's also something that, not sure who listens to this podcast, but something unique about Ice Physio and the company we teach for is we do a 10 to 20 minute workout at the end of day one, which I think can be so powerful with a full day of dry needling courses, or dry
Totally.
needling techniques. So tell me a little bit about kind of how your exercise has evolved over the time. Like, how has your dosage for post needling exercise changed too? Like, where are you at with that?
I mean, if you're asking, I started teaching 2014, but when I was sitting, like taking my first course 2010, I mean, the whole like how we use a needle, the therapeutic narrative, the pathomechanistic models, but the benefit of the needle was way different. But so was this is what we do with patients after. And
Mm.
back then it was rest, hydrate, hot pack, soft tissue work, static stretching, but very passive. So, I mean, what we're calling dry needling 2.0, one of the big paradigm shifts is what we do immediately post needle, and it's activity. And I mean, some patients, that's Gladys, could you go on a walk this evening? Other athletes, it's like, okay, we if we dial in these 2 exercises or the next like 12 to 24 hours is the time to load the tissue, to do the thing. So, I mean, clinically, it's been a big shift.
Mm.
It's an immediate reinforcement, very deliberate reinforcement. And I mean, for certain folks with lower irritability, it's like more aggressive loading, sometimes even higher intensity versus early on. There was kind of almost this fear of like, well, we wouldn't want to go too intense or go too heavy after we needled that medial gastroc. Now
Mhm.
everything is opposite and different. And I mean, we have research to say I mean, the one study I bring up on courses, we just pistoned infraspinatus. Group A is going to go out and do some concentric, eccentric stuff, extra rotation, intra-rotation, like loading the tissue that was needled. And then they have a placebo and a nocebo group, like an ultrasound group where it's not plugged in, and a group that did nothing. And I mean, what I bring up on courses, or the question I ask is, which group do you think did better for post-needle soreness? And obviously, when I
Yeah.
bring it up in that context, everyone's like, well, duh, it's the loading group. I'm like,
Well,
100%.
duh.
So
Yeah.
that's
Yeah.
what we're doing in the clinic.
Yeah. I think that's awesome. Sweet. Yeah. So I think it's really cool to see how, for you, how everything has evolved and your practice has significantly changed. But what originally got you into physical therapy? Was it your time as an athlete in college, or yeah, what drew you to the profession?
Definitely time as an athlete, but more in high school.
Mm.
I think it was before freshman or before sophomore year. I had that growth spurt, grew 6 inches over the summer. My musculoskeletal system was was adapting to that. Like
Yeah.
all that to say, I had gnarly back spasms as a
And
varsity.
still do.
I still do. Maybe it's the smudging of the cortex, but I still haven't let go of that. My
Okay.
mom was a massage therapist working at a chiropractic clinic where I was exposed to PT. So, I mean, first of all, that was my exposure to PT, but I loved that it was kind of in the context of mom's a massage therapist. It's owned by a chiropractor in a PT. Like, I kind of saw the whole alternative,
Multidisciplinary. Yeah.
holistic, yeah.
Yeah.
Because I mean,
Cool.
I was interested in med school. So there was that
Mm.
teetering of like, do you go full blown physician MD? And just even back then, before having the education, was never a big fan of like medication solving problems or injections, and honestly just fearful of surgery. And just again, before even getting in the research data, just knowing enough people that are like, yeah, I had surgery, felt better for a little bit or didn't, and now I'm back in the same spot. So to me, there just seemed like, or I guess the question I asked myself even coming out of high school is like, how do you make that longer lasting, lifelong change without all that stuff? So, I mean, PT
Yeah.
was a pretty easy place to land. Got my bachelor's in biology. So I was
Ooh.
thinking PT out of the gate, but man, if I would have stopped with my biology degree, it's like, man, you're going to be a nerd in a lab somewhere, or you're going to be teaching like high school biology, neither of
Yeah.
which sounded intriguing to me. So I'm like, all right, we got to keep going down this healthcare road.
Yeah. That's awesome. Super cool. Let's zoom back even like further or, uh, rewind to when you were growing up. What did you want to be when you grew up?
I mean, an
Everything.
astronaut or a
Yeah.
firefighter, something way different for
Firefighter
sure.
hits. Everyone wants to be a firefighter. My daughter right now, that's what she wants to be when she grows up. And I think that's so cool that, little girls want
I
to
wonder
be
what it is.
firefighters.
Like, is it like the Paw Patrol? Is it the cartoons that they see?
Oh,
Is it just that they
yeah,
see big, cool, loud trucks driving around town? Because I mean, zero influence to Aiden, and I mean he loves his dump trucks and his ambulances and his fire trucks. So
that's cool.
we'll
Yeah.
see if that's
I
where he
think
lands.
Yeah, I know it's interesting to see kind of because some people know what they want to be when they grow up. Like all of my patients that are veterinarians, they knew from the age of 4 that they
Yeah.
wanted to be a veterinarian, and I think,
I think every vet that I've met, it was like, I've loved animals since I was 2 years old. So yeah,
yeah,
there
yeah.
must
So
be
it's
something
cool.
to it.
Must be. So you got into dry needling in 2010. You started teaching in 2014. Tell us about like how you came to become an educator. And for those that are out there that are looking to get into the education space, like how can they make that shift?
I mean, it was after that first course, was I like, man, this is so cool. I'm going to devote my life to using it and teaching it? For sure not.
Yeah.
And probably a similar story to other people that have found inspiration in specialties and even been given opportunities, is I had some amazing mentors, some amazing opportunities. I mean, even before I took that first course, I was exposed to dry needling in the clinic on one of my clinicals. So Zylstra is the founder of Kineticore, and then Matt Nelson was actually my CI, who was a Kineticore faculty. Get all the credit for like exposing me to it. And even though I was skeptical, I took the first course, but I just graduated school. I was the, RCT systematic reviewed, like this. There's no evidence to support this. Like it's all placebo. Like that's how I first felt about needling, because there
Yeah.
wasn't as much research. And honestly, there's only half of the states that were doing it. This is back in 2010 when I graduated.
But Colorado was a good state. Yeah.
Exactly. So I
Yeah.
did see it used more mainstream. And I mean, even
Yeah.
as a student, like on my clinical, like you just stand in the corner of the treatment room, you see like 4 needles, not even much e-stim back then. And you see the patients like straight leg raise improve 45 degrees, or they bend down and touch their toes and they're like, I haven't touched my toes in 6 months. Or you just, we needle, you needle. So you hear things like nothing else has helped this, including injections and medication. And you
Mhm.
do your little retest off the table and you just see the eyeballs and you see the hope meter go up in our patients. So I was lucky to see that early on. And I mean, those names were how I also got into education. I mean, I paid my dues. I mean, I did unpaid teaching even when I was a student. Like I was allowed to go to some of the courses and lay on the table and be the demonstration
Cool.
tissue. So
Yeah.
I earned it for sure. But I mean, I
Yeah.
would not I would not have gotten into education without those two specifically, but really just opportunity. And I mean,
Yeah.
from there's the whole story about just, yeah, given the
Well,
opportunity, but never saying no, and just taking any opportunity I had to get better at that, but also anything else in clinical skill, continuing education, all that stuff.
yeah, I think we get asked a lot as, lead faculty with ice physios, how do I become a teaching assistant? And I think you just kind of nailed, it when you said you just keep showing up. Like, you
For
just
sure.
keep showing up. People notice that, right? You show your passion when you just keep showing up. And so I think that's the biggest advice that I can give people is like, driving. We've had some of our TAs drive 6 hours to hop on a course, not get paid for it, not get reimbursed for their travel yet,
Yep.
but seeing them evolve. And I think the biggest one is like Pat McSweeney, who's one of our lead faculty now. That was one of his first courses is he like drove to one of the other Minnesota or somewhere like that, and hopped in a course super last minute. So I think that's the biggest advice we can kind of give people if they're
Well,
looking to
dude,
get in that space.
what about your story? I know you're not going to hat tip yourself, but you were the first. I mean, you were kind of I guess, a TA for a moment, but really you kind of joined the division with the goal and the need of like, it can't just be Paul out there leading courses. We need other leads. So, I mean,
Yeah.
you had all the training, all the skills, but you did the same thing. You showed up unpaid. You showed up, you have a family as well. Your husband teaches, you have a clinic, and you took time away from all that. Because I mean, I forget the exact timeline, but kind of taking the course, kind of helping, but seeing the product for the first time, October in 2022, you were up and running as a lead less than 12 months later, which is insane.
Yeah.
And
Yeah. August was my
our
first.
division wouldn't be where it is today without that start. And you set the path and the template for folks like Pat.
Well, thank you. Yeah, I mean, so not to make this interview about me, but when I heard that dry needling was coming to ICE, that was something where I had been asked by another educator to TA for them for dry needling. And I went to Jeff and I was like, is this something I can do with already teaching for the pelvic division? And he was like, just wait. And I think I bugged you so much during the first 6 months of like you even just still creating the content. I was like, hey, I'm ready for this. So
There
I think
was
that's
this
the
weird
biggest.
pre-launch window where it's like, obviously, I think I had a full year like behind the scenes developing content and all that. So we kind of knew, yeah, Jeff knew obviously it was coming, but we didn't do the big bad announcement yet. And we
Yeah.
really weren't trying to let it leak out.
Slip. Yeah. No, I think that was really, it's been so cool to see the course evolve. And I think that's kind of
Yeah.
another thing that I want to touch on a little bit is this is a space that research is continually coming out. And so how have you tailored the courses to adapt with that, like updated research and everything like that? I think that's,
Yeah. And
yeah.
actually, at the time of this recording, I've spent, pockets of time the last week updating the iDry Needle full text research library because I've kind of
Mm.
neglected it for 18 months or so. But I'm constantly in the research. I mean, I have a window every week just to dig into PubMed and Google Scholar and see what's new. And yeah, you're right. I'm not saying every study each week is the highest quality or even shows like the best findings with it, but there is a ton of research being done in this space. And I mean, the biggest shift, if we are comparing it to the first course you and I took back in the day, is like, it's the eStim for sure.
Yeah.
I mean, even just saying eStim is like, man, are we talking eStim for pain modulation? Are we saying like strength or output changes? Like, are we stimming a nerve? Are we stimming a tendon? Are we stimming a muscle? So, I mean, eStim is the answer for research.
Mm-hmm.
And it is growing for sure. And it's not like really cool case studies anymore. It is like the one in medicine for percutaneous neuromodulation. It's systematic review in one of the most renowned medical journals in the world saying this thing works. This needle-based electricity works for pain, for muscle changes, and some really cool stuff.
Yeah.
So I mean, that's how the course has changed. And I hope it changes every 2 years moving forward. I hope in 2028 we're like, we had no idea what we were talking about in 2025.
Yeah.
This is how it's done.
Let's evolve. And so with that, where do you think dry needling's going over the next 10 years? Like, how do you think it's going to evolve?
I mean, already I did a virtual ice on this about a month ago. Already, like, that first course I took, if you looked at the contraindications, relative contraindications, precautions to today, there's been a big shift to like, we're using it on, more compromised folks, on more complex conditions in more
Mm-hmm.
supervised settings. So that's one way. I mean, if you think if you still think today that dry needling is only for myofascial pain or only for that strict orthopedic patient, it's not true. So, I mean, part of it is the horizontal expansion, lymphedema, neuropopulations, like really cool stuff that, again, we can tap into nervous system, neuromotor changes, or evacuate fluid, all that other stuff. So, I mean, that's one way. And then, I mean, I was honestly amazed when I built the advanced course, how much supportive research there is for nerve stim.
I know.
And I mean, it's not, some of it is like, the animal studies where they put a metal coil. Some of it are implanted femoral stim or suprascapular stim devices they do post-surgical on humans. But a lot more of it these days looks like what we're doing. Some of it uses ultrasound, some of it doesn't, but targeting a peripheral nerve. And it's just, it's
even
insane.
In the pelvic space. Yeah,
Yeah.
it's so cool to see. Well, that's awesome. Yeah, definitely. I think I'm excited to see where things go. I think, originally 1980s where things came, and it's evolved a ton since then. So, yeah.
And one more thought on that is, so you asked where's it go in the next 10 years? And I think it's that more e-stim, maybe more sensitive structures, more other uses, but
compromised patients. Yeah.
If we look past 10 years, I think it's going to be real easy to see a parallel of dry needling and wet needling. I think PTs having the ability to do injections, and whether that is more narrow use of pharmaceuticals like corticosteroids and stuff, or if it is, some of the biologics and other type stuff like PRP. I mean, if we prove, which I think we're proving, I wouldn't even say in every state we've fully proven it, but if we prove we're safe, but we're also one of the most accurate and one of the most appropriate professions to use a needle on the human body, I think that's going to be a natural progression.
That's really cool. Yeah. I mean, we've seen that in the imaging space too, of like states are starting to evolve to allow physical therapists to, refer for imaging, and we use it a lot less than primary care physicians or, orthopedics. So I think that's cool to think about as well. All right. So you've had, 16 years of experience needling. You're old, dude.
Is that true?
If you started in 2010, just about, right?
That's wild. 2025. I always say over a decade, but you made it sound way closer. Way closer to 20.
Almost two. So we've all had some, like, what we would say, like, oh shit moments, right? When we're needling. And maybe you don't want to dive into this. You don't want to expose some of your negative events or anything, but tell us about an oh shit moment you've had with needling.
I mean, people, when they think of the worst thing that ever happened, I've had 3 patients faint on my table. What's ironic about it, it was early on, there was no e-stim, and they were all fairly fit. 2 of them were Division I soccer guys, and those 2 guys we were treating the anterior hip. So, I mean, less of like less association with the muscles being treated, but it's just the folks that seem to have that event. None of them was a severe thing. I had a really bad event on a course once where it wasn't just a 2 or 3 second faint, but started to go in some of the posture, started to do some of the jaw thrusting stuff. I mean, it went on long enough that we initiated CPR. We got the defib, but everything was fine, but it was just a more severe, a vasovagal syncope event can affect your cardiac centers. And if it affects it long enough, that's not good.
Yeah.
Again,
wow.
he was fine the next day. But honestly, thinking back to like the most terror I had in my heart using needles in the clinic, it was back in the more piston heavy days. And man, when I would it happened at least twice, pistoning SCM. And I mean, you take it out and it's not just like a little mosquito bite hematoma. It's like a growing egg in the anterior neck. And honestly, it scared me. So, I mean, you go and soft tissue, like grab an ice cup, like again, patient was fine, but man, terrified.
Yeah.
I mean, all the nerve interactions, all the kind of weird sympathetic things about like, a little GI distress, little nauseousness were so temporary and so minor. I guess those are the things that come to mind.
Yeah. All right. Now, if you could only rely on manual therapy techniques for everything else, so all the other tools we have in our toolbox, but you could treat one thing for the rest of your life using needling, and that's it, what would it be? Either muscle or like condition. What would you say would be the most needling has the most powerful impact on?
I mean, this is kind of the opposite of the question we did like on our first or second episode about if you
Yeah.
couldn't needle one thing. So here's where I'll admit, man, needling is so powerful for spine stuff. I mean, neck pain, low back pain, radiculopathies, headaches. But I also think manual therapy can be relatively effective as well. So even though I love needling for that, I don't think that's the one thing. I mean, what's weird is it's not even a condition, but just glute medius pops up into my head
Mm.
for lots of stuff. I mean, not even just hip stuff, but SI joint, lower leg mechanics. Like, if I couldn't needle and stim glute medius, do I have other tools to kind of get that muscle responding better, turning down some of the pain for a bursitis or a lateral hip thing? I was less successful with my manual stuff there.
That's cool. Yeah, I think that's a really good pick there. Yeah, because I think, shoulder girdle, we have a ton of manual therapy stuff we can get into there. But yeah, glute med, I mean, trying to release it with, your elbow and someone's butt, not super easy. And then working on that neuromuscular facilitation and stuff like that. I think it has such an impact on lower leg mechanics and even like
Yeah.
vasodilation in the limb and all that stuff. So looking at, edema reduction and things like that too. So nice answer.
I mean, let's be clear. I would be a horrible clinician if I couldn't needle right now. That's just that's where I'm at clinically. If I lost my supplies or I wasn't allowed to needle, there would be lots of gaps for sure.
Yeah, that's fair. I did phone some friends to ask some questions. So maybe we'll do this in like a little speed round before we wrap up.
Can't wait.
I know, but tell us where the beep, 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 bonk, bonk came from. Tell us what that is.
So anybody who's taken a course with me knows when I get to a bone because it makes a noise and it goes, yeah, tap, tap. I don't know. I was actually on a course semi-recently, a few years ago, where there's a name for it. I have some sort of condition
Yeah.
where it's just, I make sound effects. Like when I'm getting on the on-ramp to the freeway, I'm like, like so yeah, but I mean, I honestly think I use my words as I'm trying to make my point in the demonstration that I'm at a bone. And I guess I don't feel like I've made that point unless I go beep, beep, beep,
Beep,
or
beep, beep.
tap, tap. So you all know that that's a bone.
Yeah. All right. You talk a lot about Gladys. Tell me who she is.
I mean, again, if you've taken any course with me or heard me talk anywhere for an hour, Gladys is my patient. And I mean, honestly, I have real Gladys's different names, but like Gladys is that, sweet, sassy 70-year-old lady. She's active, she's spry, she's walking, gardening, doing her dancercise. Like there's actual Gladyses that I've seen in my past, but you also know, if you've been on a course with me, sometimes Gladys is an NFL linebacker. Like Gladys is just the name that I have front of mind. And I mean, I probably stole it from Jeff more, but he actually has different names. Like he's got the Roger and the John. Like he teases out different personas. Like, nope, doesn't matter for me if we're talking about knee pain, low back pain, shoulder pain. It's like Gladys comes in. Your first patient on Monday is Gladys. Your second patient on Monday is also Gladys. Coming for different things, but that's the name that I have.
That's awesome. Cool. All right. More speed round here. Describe the perfect cheese curd. Wisconsin, born and raised.
First, let's get it off the table. It's not deep fried. I know some of you have been to Wisconsin and had cheese curds. It's deep fried. It's hard to mess up. And I'm not saying it's a bad bite. I mean, it's hard to go wrong with deep fried cheese, but a true cheese curd. And man, I'm now visualizing the field trips in like 3rd, 4th, 5th, 6th grade where we went to the cheese factory, like watched it being made. First of all, it's naked, like it's not deep fried. You know it's good when it's shiny and when it squeaks on your teeth when you eat it.
Yeah.
Because I mean, you can find, if you buy your cheese curds at the airport, when you fly out, it's not going to squeak. Like, I honestly don't know. Is that like
something about going through security just takes the squeak away?
No, it's the age. It's the shelf life. Like, or maybe it's like the temperature. I don't know. But if you buy it clearly
fresh from the dairy farm.
Exactly. Like if you don't buy it fresh, and I don't know if that's a day or 2 days or a week, but it's not going to squeak. It'll still be a decent curd, but that's an easy answer.
Okay. Water, flat or sparkling?
Both, but sparkling at this point. I mean,
yeah,
I drink a lot of sparkling water.
Okay. TV show versus movie?
I'm a sucker for a good miniseries. Hook me in and give me like 3 or 4 episodes.
A nice little binge. Yeah. Yeah.
Yeah.
That'll get
Like,
you.
I
Okay.
mean, I like movies. I can't remember the last time I've been to a movie, but I watch movies. But I mean, that's a commitment. You're an hour and a half
Yeah.
to 2 hours. And I mean, sometimes you don't want to turn it off, or sometimes you turn it off and don't come back to it, which I think is why I like the smaller bite of a series.
Cool. And I think you're not quite at the age with your kids of like going to my kids are into going to movies right now. And like we saw Zootopia 2 was
I
the
was gonna
last
say,
one
what are
I
you what are
saw.
you what are you watching? Because we haven't
Yeah.
been to a movie yet. Aiden
Yeah,
just
that
turned
was
3, so we're getting close.
I'd say like 4 is a good age. Like they can sit through it,
Yeah.
But all right, favorite music genre?
Indie. I
Indie.
mean,
Yeah.
that used to
Noah
be
Kahn,
like
right?
that's what it is now. Yeah, Zach Bryan, Noah Kahn, that sort of stuff. But I mean, older version of that is like Lumineers, Mumford and Sons,
Yeah.
that stuff. And that's my morning of day one Needle vibe as well. You need a
Yeah.
certain musical energy, and if you're coming in a little anxious about needling, you can't go straight to the EDM or
Well, that was going to be my next
the
question. What's
the
your
swearing.
afternoon playlist?
I mean, that's the grungier hip hop, maybe some explicit language, but definitely a higher RPM,
Okay.
higher volume as well. I mean,
Yeah.
yeah.
All right, sweet or salty?
I'm not a candy guy, but I like the cookies and stuff. I guess it's sweet still.
Yeah. Okay, cool. Well, if you had to leave our podcasters, our large audience, with one tip, trick, or something to, get them excited about needling or even just the PT profession, say we have someone like you right out of school, high volume clinic, wanting to quit the profession, what would you tell them?
You asked if I wanted the questions beforehand, and I said
I
no.
know.
So
But
I knew
this one.
so I knew you were gonna stick me with some deep philosophical one. I don't know. I think when it comes to needling, especially, at least looking back at my own journey, but sometimes meeting the folks that are kind of at the end of our road, like even if you've taken, our full series or a full series, level 1, level 2, level 3, upper, lower, advanced, I think a lot of people think that's the end of the road. Like I'm a fully accomplished needler. And I mean, I think that's where expertise starts, but I don't think that completion of a certain coursework. It's unplugged my headphone. Am I still here?
Yes, hello.
Okay.
Yeah.
You need to check those boxes sometimes for a state requirement, but I think, and the analogy is like manipulation. You take 1, 2, 3 manipulation courses, like the course itself doesn't make your hands more skilled. And I mean, I think needling is maybe a little different in that the skill acquisition, learning how to hold a needle, place a needle, that skill is quickly attained. But then, man, it's just the reps of using it in the clinic for sure. But I guess the encouragement is just having that not be the end. I mean, never stop learning is kind of the bigger MO, but it's just, man, what other people can you get around? Other courses can you take? Other patients can you use it with? I mean, because yeah, even some of your questions today, like you're not going to learn all of the what's coming next, or, even if you and I sat here honestly and said, how do we use it in the clinic? It's a little different sometimes than what we teach on the course. And I mean, I
Mhm.
think that's the true separating expertise. But
Yeah. That was a great question or answer, Paul. That was
thanks.
so
I still don't
good.
think I embodied it, but I think we got the point
No, it's never stop learning, right? That's a
for
big thing. All
sure.
right. So tell us over the next couple months, where are you going to be on the road? What courses are you teaching?
I wasn't prepared for that either because I have just wrapped up in Bellevue. Love our local Washington courses. Advanced course in Columbus next weekend. Then I have kind of a 2-weekend break from the Con Ed thing because I'm hopping over to Hawaii Pacific
Mm,
DPT. I get to adjunct out there. Sunny Honolulu with an amazing
sounds
team,
awful.
but they
Yeah.
also get a full day of needling in their therapeutic interventions lab. So I get to do the needling thing. Then I'm back in Bellevue, then a couple of weeks off, then Las Vegas. And then after Easter, I have a month-long gauntlet of an advanced in Bellevue, an advanced in Longmont, upper in Mount Holly, just outside of Charlotte, and then a lower back in Bellevue. So,
Awesome. Really hitting Bellevue hard. I love it.
man, I mean, that's home court for me. So, I mean,
Yeah.
I would teach her every weekend if there was enough interest.
Yeah. Well, you can find Paul DPT with Needles on Instagram. Hopefully you guys are following him already. If you have any follow-up questions that you want to learn about him, post them in the comments of one of our videos. What are we going to do for the for the little teaser videos. You'll see maybe another, I don't know, baby video or something like that, but post some other questions for Paul. Thanks so much for answering. Again, you kind of were just flying by the seat of your pants here. You didn't know what I was going to ask.
Thanks for running the show. I think you should be
Yeah.
the main. I'll be the co-main more often.
I don't mind interrogating you, especially about some things. So yeah, thanks for hanging out with us today, and look forward to seeing you next time.
Catch you next time. Thanks, Ellie.
Mm-hmm.